Sweet.
Easy. Right there facing that way. There you go.
Oh my goodness.
Easy. Back right here.
Zipper.
Perfect. Very nice. Wow, good timing. Had the toes perfectly painted for this.
Oh, good.
Yeah, you didn't even know this was coming.
I didn't.
We kind of we tend to ambush our patients. There you go. Sink real deep. Good. There's one. There's two. There's three.
I'm going to cry because I was so hopeless at that point, and now I am so hopeful, especially this past week. It's like I've been walking fairly normally, more than I have. My body keeps forgetting and saying, no, you're broken. So when I'm like, keep reminding it, no, you're not. And that, so if you get a chance and you have anything, come see Dr. Bang because he'll help you.
Hey everybody, Dr. Bane here. I got another one of my newer patients here. This is Lori. And Lori's going to tell you a little bit about what she's had and why she's been here, and then we'll show you a visit.
Okay. About 4 years ago, I dislocated my knee, and it healed up and everything, but I had never been able to get my forward stride back. And a friend from work had said, you need to go see Dr. Bang. You need to go see Dr. Bang. I put it off for like a year, and I finally came, and I wish I would have done it a year earlier because I'm going to cry because I was so hopeless at that point, and now I am so hopeful, especially this past week. It's like I've been walking fairly normally, more than I have. My body keeps forgetting and saying, no, you're broken. So when I'm like, keep reminding it, no, you're not. And that, so if you get a chance and you have anything, come see Dr. Bang because he'll help you.
Well, now that I'm all complimented and buttered up, let's do this thing. Okay, here, come on over here. So right here facing that way, let's just see what you got going on. Okay, relax your shoulders there. Yeah, and so you can see her posture is actually not, compared to when we started, she's starting to finally come in, and I don't remember how long it's been now, a month maybe? It's been about a month and a half,
visits,
or about a
like
month
that.
and a week. So she's already coming in now more popped up. Look down, back to normal. So when you first start working on people, they tend to be really collapsed. Look up, back to normal. But then in about 1 to 2 months of working on people, there's a moment where they start to come in a lot more popped up, and they'll stay that way usually permanently from that point forward. Now, not perfect, but much better than they ever were. It takes years to get all that junk out. So she's got a C7 here, so I'm just going to fix a little rib here first. Well, and it's the most common bone, I think, to pop out besides L5. Okay, back against this piece here. And actually, let me get you a little taller just so I don't have to, that way I don't have to bend over so much. Right there. Okay, 2 big chops here first. And so this is just, as always, I tell everybody, this is to fix the first rib here so that the shoulders can sit better. So just relax the shoulders there. First chop there. Try not to hit my nice brand new mic. There we go. And then cross these there. And then I'm going to bring this right over here. Now C7 is probably one of the bones in the body for ABC that takes a little bit more work. So bear with me here as I take my time. I'm always taking my time to get the right spot. Okay, let the head fall forward. There's my spot right there. Okay, head's gonna go right there. Keep it that way the whole time. Just relax your shoulders and legs. So now we do a lot of little pushes. Relax those shoulders. And I'm feeling, okay, I slid off a little bit because of the skin there. So I slide down a little. And I'm back here again. Now I'm closer. It moved a little bit.
Yep.
Damn.
Felt it.
Freebie. Now I'm gonna make sure I'm right there. So now I'm at the right spot. So just relax the shoulders there.
Sweet.
Easy. Right there facing that way.
Sweet.
Making me look good, Lori. All the ABC people taking too much crap about that. I got C7 first try. Okay, so let's just make sure I definitely got it. But you can see already, her head has popped up a ton. So she'll tell you, oh, my head feels a little lighter, my chin feels in the right spot. That feels much better.
Feel higher than I did when I first came in.
Yeah, and so that's why people have what I call the falling head syndrome, where their chin's constantly falling towards the floor. It's because their C7 usually up here is really forward. And a lot of patients ask, well, why does this thing keep popping out? Well, it's because everything we do now is forward. We look down all the time. People are looking at their phone or
computer.
Yeah, or reading all the time, or they're just always doing something that has some forward activity to it. So now I'm
in the recliner and slouching forward.
Okay, so she looks like she's got about a T4-ish here, and whenever T4 is out, the scaps of somebody's back tends to pop out like this. So, but what I'm going to do first is actually, I'm going to go right in here. I'm going to press right into here. Now, I'm sorry if it's ticklish.
No.
And what I'm looking for is to see if one of her ribs in here is tender. And sure enough, this one right here, she'll probably tell you, oh, that's a little sore, but not bad.
It feels pinchy, like it's weird.
Especially this one right here. So that means that her fourth rib is really caught. So I'm gonna have you come back right over here for me, face towards that way. I'm gonna go right there. I'm gonna scoop right there, and I want you to let your head fall back on my shoulder and relax these arms. There you go.
Oh my goodness.
Easy. Back right here.
Zipper.
So now that I fixed the rib, I'm gonna fix the bone, and then I'll go back in there, and it should be a lot less tender when I push those two ribs. So relax your shoulders there, and just gently let your head relax towards me. And already went. So with ABC, most bones move before you even do anything. And now you can look at her, you can see her scaps here. You see how they're all the way back, and she'll tell you, oh, that feels nicer because my shoulders are a little bit further.
It's weird.
So now I'll go back in here, and it shouldn't be anywhere near, see, I'm in here, and I can push twice as hard, and it'll bug her less than it did previously. Especially this one, the lump is gone. There was a big lump right here. So let those go. So that's just a couple of things that are a little more advanced ABC for a lot of those people that have been watching for a long time. Especially if you've been watching since the really bad early days. Those videos were something special. Yeah, if you ever want if you ever want to have a good chuckle, go back to like the first 2 videos I ever made. Those are crazy.
Everybody's got to start somewhere.
Backer, you got to start somewhere. I just want to let everybody know I've invested a lot in the camera equipment and editing. Okay, so we get way down here. So let that head fall way forward. All the way. Let your body relax and slouch. Keep coming. Relax those shoulders more. Looser here. Oh, buddy.
Sweet.
Easy. Easy. And I barely pushed.
Yep.
Yeah, and you can see she just keeps popping up better each time I do something. So now we're getting into the upper lumbars here. She's still good. Getting near something here. Not quite yet. I bet you we're going to find something pretty close, though. Looks like we're going to go right to here. Yep. So we're going to do her L4. So give me a sec here. All right, let me get my finger back on that so I don't lose it. Okay, sit right in the middle, legs towards this wall here. Yeah, it's all right. So that's her thing, is she gets this kind of interesting thing where her knee gives out randomly. But it's just because her spine has been so unstable for so long that it's cutting that leg off.
Yeah, it's like way.
Yeah, I wish everybody would have seen how it started, because it used to be much worse. Let the head fall forward. Stomach and legs loose. I've got you. Right here, let it go. Perfect. Very nice.
I can feel myself more relaxed than I normally am too.
Well, a perfect day to be more relaxed than normal. So, yeah, and you can see now she's even more. And the thing I just saw now is now that L4 is in, she's not swaying as much back and forth if you look at her. So part of the reason people's knees give out is because usually L4 or 5 is forward. That's why their knee starts blowing out and doing all that kind of weird stuff. So L5 is okay. At least for the most part here. Let me double check, but it looks okay. Yep, L5's okay. So I'm gonna check the sacrum just to make sure. And just because, so normally, right, because she's so stable now, I'd probably leave her alone for the visit. I'd recheck the top end, leave it alone before I pull something out, but most people wanna see the whole thing. So lay face up for me, I'm gonna check her legs. So head here, legs towards my side.
Head's here?
Yep.
Okay.
Just to show everybody how the whole protocol looks.
Gotcha.
But for probably about half my patients, I don't always take them through the whole protocol, because if you do, then you can sometimes destabilize people a little bit where you can't get them quite as perfect as you had them. And I'm kind of a perfectionist.
What?
But that's just me. There we go. Good. Yep. Thank you. Wow, good timing. Had the toes perfectly painted for this.
Oh, good.
Yeah, you didn't even know this was coming.
I didn't.
We kind of we tend to ambush our patients. I don't tend to pre-tell anybody. I just find a good day where I've got a gap somewhere in there, and I put a bunch of notes on people that says, you know, would they be willing to record? And I just put a bunch of little notes about it. That way we can hopefully get somebody. Let this come. So now I'm going to fix her fibula just to make sure. Nope, fibula's okay there. Let's try this guy.
This one popped on my way in here.
And that fibula actually is okay too. So let's just see her breathing. So let the arms relax. Just going to check the breathing in the chest. So take a nice deep breath. And honestly, very good. The only thing she has is, if you wouldn't mind, take one more breath. What I want you to notice is it gets caught right there. So the second she got about 3/4 in, she's doing well, it's rising, and then everything keeps rising except for this moment right here, so it means that these ribs here are caught, okay? So if I go in here, she'll tell you, oop, that's a little tender, that's a really tender one. But if I go down here, these are fine, okay? That's because these ones are all caught. So I'm actually gonna fix those for you, Lori, because I probably haven't done that for you.
I've been coughing for...
Oh, well, that might make sense then. So take a deep breath. Biggest one you can. As you breathe out, I'm gonna compress all these ribs in. Just let your chest sink. There you go, sink real deep. Good, there's 1, there's 2, there's 3. Take a deep breath, so that released good. And let it go. Yeah, it's gurgling. 1, oh yeah, 2, good. So now what's gonna happen is we should see that catching point disappear. Oh yeah, oh yeah.
Right now.
It's gone.
Sweet.
Come on up here facing this way. Now, let's see if she gets a little spacey when she gets up.
Yeah, but not
Not too bad.
Not too bad.
But you can see she looks a little drunk again, okay? Not much.
Drunken sailor.
Yeah, a couple margs, a couple margaritas. Now, the reason that happens, and this is once again the reason I typically, in certain people like her body, I don't do the feet, is because of that reaction. Because that means a bunch of things I have to get refixed. So what I'm going to do is I'm going to go back in here. I'm going to see what came out. Usually it's one of the lumbars came back out. Probably that lumbar I had to do a couple minutes ago. And sure enough, it's the same lumbar I did a couple minutes ago. So just sit there, legs that way. Let's grab this. Cross your arms there. Flip these out a little. And it's the same thing we did earlier.
Okay.
Head to the floor. Now this time we're gonna go all the way. So relax the stomach. I'm gonna go right here. Let your stomach go loose or fall all the way. That's it. It didn't need much, just enough. And let's see how we're looking. Okay, good. So she's a little more stable again. And then let's go up to the top end. So that's back in. Bring the chin up. The second bone I might have pulled out would have been that first one I did, which would have been 7. So I'm going to check on 7. Yeah, and sure enough, I pulled out just a teensy bit. Not much, just enough. Cross the arms there. Flip that over just a little. Okay, so once again, I'm going to take my time, just because C7 is really particular. Let the head fall forward. So I'm just feeling for my spot. Good, head's gonna go right there. Perfect, thank you. And just relax the shoulders there. Lots of little pushes, head's perfect. So relax the shoulders, good. So I slid off a little, so I'm gonna come down. Starting to slide less, I'm almost there. Relax the shoulders. And that's gonna be my spot. So just nice and loose here. Relax the shoulders. Yeah, we did it twice.
2 for 2.
So Jesse watches this. We'll go to a lot of seminars. I'm getting more C7s. Okay, so let's see. Okay, so let's check back to C7 again. Good, and that's refixed. Fixed there. That looks good. 4th is out a little bit again, so I'm just gonna rib lift it to see if that'll fix it. Relax the shoulders. And it did.
Yeah.
Now take a deep breath. And now she's very balanced. She doesn't look like she's got the drunk sailor thing she had a second ago. Nope. So turn towards the camera. Is it worth coming to get ABC?
Absolutely. Absolutely.
Awesome. So if you guys are interested, you can go to our website or give us a call. I'm taking new patients. We'd love to see you. All right, guys. Thanks.